All right, let's get you a quick update with regards to COVID-19, the novel coronavirus. What's happening in Europe? Let me bring in our correspondent, Ira Spitzer, who's live for us in Berlin, Germany. Ira, a very good morning to you. Talk to us about the impact that COVID-19 has had in Berlin, in Germany as a whole. We know that Italy has one of the biggest outbreaks in Europe, close to 4,000 cases. At least 148 people have died in Italy. Schools have shut down. It's affecting sporting events. What's the situation in Germany, Ira?
Well, good morning to you as well. And we certainly have seen an escalation of spreading of the coronavirus in Europe over the past few days. There's been a doubling of cases just in the past 3 days alone. And as you mentioned, Italy is, of course, the hardest hit so far by this virus. But Germany now is the second most affected country in Europe. There are over 600 cases of the virus here, and every day we've woken up to news of a significant rise in infections. So the capital here, Berlin, as well as all across the country, is really on a state of high alert right now, trying to stop the spread of the virus. Now, that being said, well, we have seen numerous cancellations of large events so far. Sporting events even are starting to be canceled. Well, we have seen that there is not, I would say, an overall sense of panic yet, at least here in Berlin. I have not, for example, seen a proliferation of people wearing masks on public transportation or anything like that yet, but certainly very concerning for Germany and other European countries. We're seeing what's happening in Italy, where now almost 200 people have died. The virus is certainly very dangerous for everyone, but especially the elderly and people with pre-existing health conditions. So a lot of concern here.
Countries like the United States, Ira, have had issues with regards to testing kits. What's the situation in Germany? Are there enough testing kits in Germany?
Well, the situation here appears to be better than what's been reported so far in the United States. Right now, the procedure is if you suspect that you might have the coronavirus, which would mean you have some of those initial symptoms, as well as possibly having come into contact with a contaminated person or a region where there has been an outbreak. There is a number that you are supposed to call, and you should be tested as soon as possible. Now, I'm not sure that procedure is completely working, but they do seem to have gotten a hold of the situation as far as this initial phase of testing. Now, that being said, with the virus spreading at the rate that it is spreading now, there are concerns certainly among the public that medical authorities might not have the proper either testing equipment or protective equipment to manage what could become a larger outbreak.
I already say Germany is on high alert. What exactly does that mean with regards to ports of entry? Limiting flights, is that one of the measures taken?
There haven't really been those drastic measures taken yet. The borders of the country are still open, which of course has led to a proliferation, it seems, of cases the closer you get to the Italian border. However, the measures so far have largely been to try and educate the population both about the dangers of the virus as well as ways to stop it from spreading, which, as I imagine your viewers there will have heard as well, largely relate to washing hands and avoiding areas of large crowds or areas where there could be some sort of coronavirus risk. But in terms of quarantines, there was, if an area does become overrun with cases, as actually happened in a region in the west of the country, there are quarantine type measures that are being taken. But besides that, the idea now is to go into self-quarantine if you are diagnosed with the coronavirus.
You know, Ira, you mentioned the issue of educating the population. I'm not sure what's happening in Germany. Maybe you can just brief us with regards to that. But misinformation, fake news as we know it, is a big issue around the world with regards to victimization of people who have contracted COVID-19. They say the disease is not the only thing that spreads. Misinformation, fake news is also very contagious. What's the situation there with regards to that?
Absolutely. Fake news, both in Europe and other places in the world with regards to the coronavirus, is becoming a growing issue. And here we have seen significant efforts by German health authorities to try and catch misinformation before it starts and to essentially publish and broadcast their own correct information before people start sharing things on social media that really might not be helpful. So I think here people are fairly have a reasonable amount of confidence in the government and the media, I would say. So people are secure in the fact that the German government is trying to at least educate them. I think that is a fair statement. But with that being said, certainly concerns about false information spreading.
What about social distancing, Ira, with regards to, how are people adapting to this? How are they adjusting to what has become a new sort of lifestyle around the world? I was looking at reports coming out of China and Shanghai in particular. When people are shopping, they need to keep a certain distance away from each other because we know that this virus spreads via droplets. It doesn't linger in the air like, say, for instance, measles. So you have to be in proximity, close proximity to a person in order to get it via if the person coughs or sneezes. But talk to us about precautionary measures, issues like using masks. Is that ubiquitous in Germany?
Right. Well, as we were discussing earlier, one of the preventative measures that the government has recommended is keeping your distance from other people, especially in public, where someone you don't know might already be infected with the coronavirus. And just anecdotally, I will say that going around Berlin right now, especially on public transportation, you do notice that people are aware of their space, and getting too close to the space of another person is at the moment a problem because of the fears of spreading the coronavirus. Now, when you look at the situation and how it's spread, there is, of course, the worry that people who have the virus, because in many cases the symptoms are not severe, or in some cases are not there at all. Many people, of course, could have the virus and have no idea that they have it, and that is probably the most dangerous situation. You mentioned masks as well. One of the recommendations here and elsewhere is that the people who should wear masks are the people who actually know that they have the coronavirus. There is a worry about a mask shortage, and in fact, Germany and France have banned the export of masks here to other countries because they want to make sure that there are enough masks for healthcare professionals as well as people who are infected with the virus. So actually, if you don't have the coronavirus, it's not recommended that you wear a mask because people don't need to be protected from you. The issue is the people that actually are infected.
Correct. Ira, thank you very much indeed for that update. No doubt we'll keep in touch with you to get the very latest coming out of Germany. Now sitting at about 600 cases, Ira tells us, in Germany. It's the second highest, he says, after Italy. In Italy is about 4,000 cases and a number of deaths, just less than 200 deaths in Italy so far. So, look, we're still uncertain in terms of the trajectory of COVID-19. We see some positivity coming out of China, whereby this virus seems to be in the decline there. It's hovering around, I'm talking globally now, around 3% in terms of mortality rate. But we know that 80% of people who contract this virus recover well. It's those people that have the underlying conditions like heart disease, like chronic lung disease, and as well as diabetes that needs to be extra cautious with regards to that. So there's a lot that scientists still don't know about this in terms of how long this disease or this loss on surfaces, how long can it live on surfaces. Data on that is not conclusive at this stage. For instance, we don't know if a person catches it, can they get it again? If they catch it, they recover, can they get it again? So, we're still learning, but a lot is known about it, and I guess we need to work off that science in order to take this forward. Hand washing, that is the main thing. If you're listening to a number of experts, they say wash your hands as regularly as you can, clean surfaces as regularly as you can, and if you're using a sanitizer, make sure that the sanitizer alcohol percentage is over 60%. So some important information coming through. All right.